I educate my own patient and then hence help the community which is coming to me directly. So I have no financial interest. As we all know, diabetes is an epidemic and prevention is certainly better than cure. We all know about the WHO figures, so I'll be stressing on diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication and a regular screening and treatment for complications. Our role as an ophthalmologist here: screen all newly diagnosed diabetics, routine retina evaluation with documentation if possible, central field with disc and macula to be analyzed and to be put effect on, educating the patient about the negligence towards good glycemic control. Part of any eye workup with all our hospitals, we do a routine vision charting, we do refraction. Now IOP is, of course, with the help of these NCTs and tonopan, has become our routine evaluation part. And now this is what I'll be stressing on, that we need to have a device something like this, a non-mydriatic fundus camera, which gives us the center picture for the retina, the important area of the retina, I would say. So what is this system? It's a non-mydriatic fundus camera. It's fully automated, easy to be used, central fundus view, and it can create a montage if required, and it certainly takes some anterior segment pictures also. It's a compact design. I've started to use it in all my patients who can just place the chin on chin ridge irrespective of the age. All workup is done in the optometrist room and then it is linked via LAN to my OPD chamber, and as the patient is with me, for examination, I have the pictures ready. So for patients whose pupils are really small, we certainly do dilate them, but 70% of lately we are able to do a non-dilated examination. So registration, the primary workup, this is how they sit there, and I have the patient and the attender and the image there ready to be explained to the patient. So I'll just show you some of the images. So see, all these initial diabetics, if you tell them ki bhai diabetes ka nuksan shuru ho gaya, it is difficult for them to understand at that level where I am. Even for an educated class ki aankh mein khoon aa gaya, it is very difficult for them to understand. So if you show them the picture right there and educate them ki this is the starting, and if you really stop here, it matters a lot. So all these gross pictures, you can enlarge the picture and again show it something like this. All these devastating changes with diabetes can cause to the patient's eye, and most of them are irreversible in that case. Documentation also is important once you start treating it, and then as the patient keeps coming, you tell them that now see you're improving. That again also has a very positive impact on them. A scar like this, if you tell them that this is your weak eye and we can't do much about this, it gives an importance to the other eye for that patient. He is much more educated about it. So now this is an interesting patient wherein it was an undilated picture taken and I spotted the hemorrhage there. So in a routine OPD, if you don't do a dilated checkup for all your patients, which is difficult in a heavy OPD at times, I would have missed this hemorrhage there and this one here. So both of them turned out to be not a heavy diabetics, but yes, the startup diabetics. So we of course are helping our community in educating them with the pictures. So I'll rush through as we are running late. So these are some of the examples. It can take the pictures for the optic disc also, the papillodemas, and the pale disc of course, and monitoring in the glaucoma patients as well. And at times, if required, for the prognosis points, you take the anterior segment pictures, which are not very great, but still you can spot and show them that now it has been removed, or the ulcers, how it looks like, just to teach them. I don't know if the pictures are clear there. So heterochromias and the pterygium. So importance in the practice, just one more minute. It improves the patient compliance, helps in counseling and understanding of the pathology. Printout is handed over if required, and the follow-ups for all these BRVOs and the disc monitorings. And of course an early detection, as we just discussed, that though hemorrhages patients which I showed you would have been really difficult to take up in an undilated pupil. So this could have been easily missed. And benefits, of course, it's fast, time saving, patient waiting time is reduced, it's automatic, hence little cooperation is required from the patient's point. For routine checkup saves time, and patient who are coming far from and were self-driving, you really need not dilate them, because on their way back it is difficult for them. And good explanation about the disease and documented printout helps in good compliance. So I'll just summarize. It's a fully automated, helpful in retina and disc pathologies, helps in early detection and follow-ups. It's patient-friendly, very helpful in counseling and practice, and it is time-saving. I have screened close to 16,000 plus eyes in just 8 months of installation in my own OPD. That ways. Thank you.